what is the difference between mental health and mental health issues? Because a lot of people will say, okay, it's like you have mental health, and then some people mistake it for some will say, okay, you have mental health issues. So at what point is which is bad and which is good? Maybe that's the right word.
Mental health is a continuum. So let's say this is mental health, right? And right in the middle here, we could say it's a place where you are emotionally, psychologically, mentally stable to deal with or accepting of daily life challenges. You find the hope to go to work and all of that. And if we move towards this end of the scale, that you're perfectly fine, you handle challenges well, you find your joy and fulfillment in your daily activities, mentally, physically, biologically, you're taking good care of yourself, doesn't mean that you have $1 million in the bank. If you do, congratulations. And, your self-care and self-awareness, and sense of who you are is, top notch. Now, coming to this place is where you're withdrawn, appetite is bad, negative view of everything that's happening around you, no hope for tomorrow, all of that stuff. And this is where we're sinking into depression, anxiety, stress, withdrawal, and all of those other negative stuff. So when we say mental health, it doesn't necessarily mean that something bad is happening. It is a state of well-being. It's like saying I'm physically healthy. So mental health is a state of well-being, and it's a continuum. The person who's here sometimes can, veer towards this angle. The important thing is that you're catching yourself. The word mental health on its own isn't a diagnosis. It's saying, I'm here and I have the tendency, I'm catching myself. I probably would slip into this side, the negative end. So I don't want you to do anything or say anything that can, make that happen faster or easier.
Oh, okay. We'll begin this conversation taking a quote from Charles Bukowski, who is a German-American poet, novelist, and short story writer. He once said, "Sometimes you climb out of bed in the morning and you think, I am not going to make it. But you laugh inside, remembering all the times you have felt that way." Absolutely spot on. My next one is from Cody Keppingal, who is an American author and young adult and middle-aged grade books. Once said, "You can't control everything. Sometimes you just need to relax and have faith that things will work out. Let go a little and just let life happen." Okay. My last quote is from Prof. Albus Dumbledore, who is a fictional character in J.K. Rowling Harry Potter serials. For most of the serials, he is the headmaster of the Wizarding School, Hogwarts. I'm sure a lot of people know that movie. Anyway, he once said, "Happiness can be found even in the darkest of times if one only remembers to turn on the light." And I agree with that one. Let's see how this quote relates to what we'll be discussing today. Very warm greetings and welcome to The Conversation. We're reaching you from KAFTAN's television studio here in the nation's capital, Abuja. I am Annabelle Oji. Tonight, we'll turn our attention to mental health, as mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescent through adulthood. Over the course of your life, if you experience mental health problems, your thinking, your mood, and behavior could be affected. Many factors contribute to mental health problems, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, family history of mental health problems, just to mention a few. Now, mental health problems are common, but guess what? It is not a complete death sentence, as help is always available. People with mental health problems can get better and even recover completely. Now, what are the early signs, or what are those warning signs to mental health issues? In case you are not sure if you or someone living close to you is having issues of mental health or having mental health challenges, then some of the early signs that you should be looking out for are: 1. Eating or sleeping too much or too little. 2. Pulling away from people and usual activities. 3. Having low or no energy. 4 is feeling numb or carefree, like nothing really matters to you, having unexplained aches and pains. And the next is feeling helpless or hopeless. Another one is smoking, drinking, or using drugs more than usual. Feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared is another warning sign you should look out for. And next is that yelling or fighting with family and friends, uncontrollable without justifiable reasons. Experiencing severe mood swings that cause problems in relationship. Next is having persistent thoughts and memories that you cannot get out of your head. Next is thinking of harming yourself or others, and that's being suicidal. Inability to perform daily tasks like taking care of your kids or getting to school or work, and much more. They are quite enormous. But tonight we will be speaking with Esther Abbah, who is a counselor, psychotherapist based in Galway, a member of Black Therapists Ireland, currently working independently with BTI and with a couple of Irish-based mental health organizations. Now, her interest is in she's mainly intrigued by how mental health affects people of different races, specifically in the African, Asian, and the European communities, as well as how it manifests, is interpreted, and also dealt with among these cultures. I'm sure you were interested in this part of the show. Now, another strong area of her practice or expertise, aside from that's one-to-one counseling and psychotherapy, is psychoeducation, which is centered around mental health and empowering individuals and groups towards mental and emotional freedom. Now, you are up for a very interesting show tonight. Ladies and gentlemen, grab your seat with your cup of water or freshly made juice, or maybe tea works better for you even this night. And let's have this conversation on mental health, because everyone needs to hear this. So go pick up your friends or your neighbors, because they also need to watch this episode of The Conversation. Ladies and gentlemen, welcome to The Conversation, and I will be your host. Welcome back. If you just joined us, this is The Conversation. We're reaching you from KAFTAN's television studio here in the nation's capital, Abuja. And as I said earlier, our topic of discussion for today is mental health. We'll be talking about mental health, and my guest is Esther Abbah, who is a psychotherapist. It is great to have you on the show again today, ma'am.
It's great to see you again.
Great, awesome. Okay, so now we're talking about mental health, and then at some point someone asked me, so why are you talking about mental health again? But then I just realized that we always need to talk about these issues, especially with regards to mental health. So probably for that person who is watching, because definitely he's watching at the moment, and he keeps asking, so can you just tone down a little bit and don't just talk about mental health again, let's just move. Can you just tell us why we always need to educate people on mental health?
I think that generally the subject of mental health is something that a lot of people are afraid of, and it is nothing to be afraid of, because we need to talk about mental health because life continues to happen, and the subject of mental health is a continuum. And because life continues to happen and we continue to face challenges, it becomes really important then to keep ourselves reminded of the possible challenges that continues to come with the changes that we encounter in life, as that could be a trigger for poor mental health.
So I hear you say that we always need to talk about mental health because a lot of people are scared about that discussion or that topic. Why exactly does it trigger fear in people? Does it mean that anyone who is scared of talking about mental health probably has a mental health issue?
It's not that everybody who is scared of talking about mental health has a mental health issue. We're scared about it or around that subject because of the stigma and the misconceptions that, have come as a result of, when it ends poorly, or how the community or the society, addresses people who open up to having these challenges. So it's not necessary that everybody who's afraid of mental health, of course, we're afraid of mental health, because at the end of the day, I could find myself in a psychiatric unit. That is the scariest part. But it's also how we talk about early diagnosis for everything else. So it is becoming a little bit more comfortable with it, because if it's okay to have a headache, or a tummy bug, or a fever, or God absolutely forbid, cancer, then your mind has the right to malfunction sometimes, but we're always focused on all the other stuff, but not this one, as a result of fear. And I don't think, based on understanding, that any of them is scarier than the other.
So now I hear you talk about the stigma. You talked about it could lead to you finding yourself in a psychiatric. So now let's understand what is the connection between mental health and madness?
Madness is the word that I would stay away from, because it's one of the things that brings about the stigma as well. So, for instance, we start from a point where, someone maybe lost their job. This is something that could trigger a lot of anxiety, low moods, isolation and stuff like that. So that is a normal, sequence of things that when we go through loss, the very sad feelings that come as a result of that. And over a long period of time, low mood, anxiety can lead to withdrawal, can lead to malnourishment, can lead to a few other things. And I often talk about the biopsychosocial approach, to understanding mental health, which means that an individual can have a biological predisposition, like, the state of your physical health. Imagine people who get, diagnosis. Would you not feel sad? Would you not feel depressed? Would you not feel anxious? All those things are normal. And we have the social aspect of things, which is how does the environment, accommodate you and create a sense of understanding and empathy. And we have the psychological component, which means how I am able to cope with things, and the interpretation and my understanding and my perception and all of that stuff comes together. Now, the lack or the absence of these things can lead to deterioration, not more than any other diagnosis. To say, if I get malaria and I don't diagnose it and take appropriate treatment, then it can cause damage to organs in my body.
Did you just say malaria?
I did, yeah.
Okay.
I'm using that just as a context to say, if I have malaria and I don't go and have it treated, in the medical sense of it, over a long period of time, if I stayed with that, it will still kill me, wouldn't it? So, and that's how we deal with mental health, to say, if you do not get help, it's one symptom leading to another, and then they have comorbidities as well, and then it progresses, and then it deteriorates, and it comes to a point where, you find yourself in, the same spot where you are dreadful of.
Oh, wow. Okay, so we'll go back to the fact that you talked about malaria, even as you gave that as just a one-off example. But then a lot of people will just trivialize malaria and say, is it not just malaria? I'll just take anti-malaria and then I'm good to go. I'll just take one paracetamol or one over-the-counter drug and I am just fine. So are we supposed to trivialize even something as, I don't want to use small, so it doesn't look like I'm even also following that same path. So are we supposed to trivialize any sickness at all? Let's take it that way.
Absolutely not. Absolutely not. And you mentioned there, so a little bit of an over-the-counter medication. And I think one of the things that we can be quite reckless about is the fact that we become really familiar with ourselves, not noticing the changes. For instance, who you were 6 weeks ago is not who you are today. And if only your system was open up for you to see how you're growing and the things that are changing emotionally, psychologically, and otherwise, then you'd know that something has shifted or something has receded whatsoever, depending on diet, lifestyle, sleep, all of that stuff. So we're not supposed to trivialize anything. And when people go over the counter to, get medications that you're unsure of, my thing is, how are you so sure without a medical evaluation that that's exactly what you need? And it brings us to, the genetic component of the biopsychosocial approach, right? That sometimes we have biological, components like what are my medical and genetic predisposition. So that I don't know. And now I've gone to buy an over-the-counter medication. What if that doesn't sit with me? So the people who've had a combination of medication that has led to, drug-induced psychosis before. And I know that that sounds quite extreme. And that's why we have to be careful thinking that we know what's going on and we know the medication that the doctor prescribed the last time. So we go and get it.
All right. So speaking about mental health, what exactly are the signs or the early signs that people need to look out for to know that the person sitting or standing or living with you probably has a mental health issue?
So one way to catch symptoms of mental health is even from the very smallest of, behavioral changes. Like they don't communicate as much as they do, they're a little bit more reserved, they're not eating as much as they used to, or they are a wee bit more withdrawn than usual. Those would be some of the early signs. It shows that someone has something on their mind that they're worried about, maybe.
Okay, so I think the first question I was even supposed to ask is, what is the difference between mental health and mental health issues? Because a lot of people will say, okay, it's like you have mental health. And then some people mistake it for, some will say, okay, you have mental health issues. So at what point is, which is bad and which is good? Maybe that's the right word.
Mental health is a continuum. So let's say this is mental health, right? And right in the middle here, we could say it's a place where you are emotionally, psychologically, mentally stable to deal with or accepting of daily life challenges. You find the hope to go to work and all of that. And if we move towards this end of the scale, that you're perfectly fine, you handle challenges well, you find your joy and fulfillment in your daily activities, mentally, physically, biologically, you're taking good care of yourself, doesn't mean that you have $1 million in the bank. If you do, congratulations. And, your self-care and self-awareness, and sense of who you are is, top notch. Now, coming to this place is where you're withdrawn, appetite is bad, negative view of everything that's happening around you, no hope for tomorrow, all of that stuff. And this is where we're sinking into depression, anxiety, stress, withdrawal, and all of those other negative stuff. So when we say mental health, it doesn't necessarily mean that something bad is happening. It is a state of well-being. It's like saying I'm physically healthy. So mental health is a state of well-being, and it's a continuum. The person who's here sometimes can, veer towards this angle. The important thing is that you're catching yourself. So for instance, when you lose a job, for instance, when someone dies, it's okay to move towards, so is the ability to say, hey, something's gone wrong, accepting it, finding ways to deal with it, and then coming back to where, you're kind of more stable and more aware of yourself and your goals in life, I suppose.
Okay, so people who have that mental health challenge, they can actually be called back?
Absolutely, yes.
Oh, all right, great.
And that's the goal, yeah.
Go ahead, please.
Yeah, so that's the goal, to say, oh, something has happened to me. I'll use myself as an example. So something has happened, and the impact of that, or the effect of what has happened on me. So there is the activating, event, and it's understanding and accepting and recognizing the activating event, and then the symptoms that follow, and to say, what can I do about it? And it's talking to someone who's well equipped and well informed around that area, to help you find coping mechanisms and what you can do to help you recover. Just like we do, when we feel unwell and we go see the doctor.
Okay, so now I have a particular neighbor who sometimes she's just here, she's there. Okay, let's just say she has mood swing, and then for her, she felt like at some point she feels that she's delving into depression, but some people tell her that most of other neighbors will just tell her that I think you're just fine. Anybody can have mood swing. It doesn't have to be. It doesn't necessarily have to be anything about depression or mental health, or she should not give it a name. So, does it mean that when someone have mood swings and it comes in like almost every time, constantly, does it mean that we need to check again and see if that person is fine? Or is it looking as if maybe we're trying to have like our own diagnosis, so instead she should better go to the hospital?
One thing around mental health, again, is people's assumptions around what it is. We don't know what it is.
Okay.
And also it's watering down someone's symptoms. So what your neighbor is feeling is valid to them. And the other neighbors aren't in the best position to tell her what to do. I think the best thing to do, usually when anyone's worried about the mental health, the first point of call would be your doctor. Doctors are well able to, refer you on. And I think that this field is a collaboration as well. As much as not everything is mental health, not everything is also, based on prescriptions and drugs stuff as well. So your doctor would be able to refer you on to someone who's more capable. Mood swings could be imbalance in hormones, it could be mental health. I would be interested in looking at that neighbor's lifestyle and what's going on for them, because that can be a huge trigger.
All right, so now I also hear you say that we should not give it a name, but then you have some people who tell you that, oh, please, I'm trying to settle. Don't stress me, because don't disturb my mental health. So does it actually now mean that we are just giving it a name? Almost everyone is giving it a name. Don't stress my mental health. Oh, please, I'm trying to take care of my mental health. Are we trying to give it a name when there's nothing attached to it?
Look at what is that person telling you, when they say, because there is another field that I work in, and one thing that I always look for is the words coming out of your mouth are like balloons. It's an invitation. Okay. So when you're telling me, someone's telling you, I'm trying to settle, don't stress me because I'm trying to take care of my mental health. Maybe there's something that is not said.
Oh.
What else is going? Because what that person is trying to tell you is what you would understand. So I have used the word mental health there, and there's nothing wrong with, I want to take care of my mental health. So whatever request you're bringing at the moment is a little bit too much for me to handle, and that's fine. But underneath that might be a lot of things that weren't said, or it's not being said, by the person who's communicating with you. So the use of the word mental health on its own isn't a diagnosis. It's saying, I'm here and I have the tendency, I'm catching myself, I probably would slip into this side, the negative end. So I don't want you to do anything or say anything that can, make that happen faster or easier.
Oh, okay. All right. So because you talked about the diagnosis, now what exactly are the kind of diagnosis you should go for, especially when you think that something is wrong right there? what are the kind of diagnoses? Is it, do you have to go to through a test, a lab test, a scan or something? That's one on the side. Two questions I'm going to ask you, and I would like you to unbundle them in one breath. Now, that's one on the side about the diagnosis, and then when you finally, or when the person finally finds out that he has one mental health issue or the other, are you supposed to start taking drugs? Because if the issue is probably I lost my mom, and since then I feel like there's something wrong with my mental health, am I supposed to start taking drugs to take care of that?
So what diagnosis should we go for? If you usually, to get a diagnosis and put a name to it, because there are things that are seasonal and there are things that are kind of part of, you know, the normal life happening, normal life events. If you haven't slept well, you can actually have symptoms that are similar to someone who's depressed. Now, that's a one-night event or one-week event. So diagnoses come over a period of time, to say, for a period of 6 weeks, I've isolated myself. I've not been able to eat. I have not found, you know, interest in things that I used to enjoy for a period of time, right? And this means it begins to trigger hormonal changes. And sometimes when a scan is done, you know, the waves in, you know, in the system, in your brain and all of that, you know, shows that things aren't, you know, how they used to be, and chemical changes as well. So now over a period of time is where we can say, yes, this is really happening, you know. Now, it doesn't mean that after that straight in you start taking medication. Now we have psychologists and we have psychiatrists to take care of that aspect of things. But no, the answer is no, because it's not, oh, you're depressed, now you have to start taking medication. There's talk therapy. There are other things that we can start doing, like, you know, taking care and control of your diet, you know, your sleep pattern or habits, you know, trying to reintroduce yourself into the society where, you know, you can have a well-established support system who can help you cope with things. Exercise and, you know, contact with nature is something that is under discussed but has high values as well. So it's not straight into medication.
Okay.
Yeah.
Great. All right, so let's talk about if it is hereditary or not. We've found out that mental health can actually be, you can inherit it from a parent or a family lineage, or is from the gene, or stuff like that. So if you know that probably you've seen it happen to your mom or to your parents or to your grandparent, at that point, what are you supposed to do? Are you supposed to start checking it, and how do you actually go about it?
So this is the biological component, you know. It stems from your physical health, genetic vulnerabilities, and drug effect. I'll give you an example. Again, this would be more medical and psychiatric aspect of things. So if I've seen my mom go through depression, I'm in that environment, which means I have been exposed to all the symptoms of depression, like anger outburst, you know, an extremely quiet and non-interactive environment. And so that becomes my norm from the word go. And what that does is it reduces my capacity for tolerance and to be able to cope with life as a whole. So I'm already predisposed to these things. Now I get dumped into an environment, a work environment, where it's stressful, where, you know, it's non-empathetic, where there is a lot of pressure, where people don't understand, or maybe I don't even know how to communicate myself. Do you know? So that can be already a predisposition to mental health. Now, what do I do if I found myself in an environment where such a thing has happened before? Is understanding, you know, the options that are available to me, to say, if someone has gone through it, doesn't necessarily mean that I have to go through it. So what are the support that's there out there for me? Do I see a general practitioner to direct me on to, you know, a psychologist for an evaluation, and then to connect me with a talk therapist, and then to maybe keep an eye on other aspects of my life so that I don't fall into the same pattern.
So that means when you're going to the hospital and you feel like you want to see someone, the first person you should ask for is a general practitioner or a psychotherapist or a talk therapist. Who exactly are you supposed to ask to see?
Well, how things work here is if someone feels like they have symptoms that they don't quite understand around mental health, because at the beginning people don't understand, you go to your GP, which is the general practitioner. Now,
Okay.
the GP would go through a series of questions with you and see where you're at, and they would say, I would refer you on to a psychologist or a talk therapist. Now, once you get into the system, after an evaluation, they'll connect you with the various support systems that you can or that is available to you. You might need medication, you might absolutely not. You might need, and I think that at this point, based on your question, you would need to be talking to a therapist and, to be connected to the medical personnel as well for an evaluation if that is necessary. So we go back and forth like that.
Oh, great. All right, so we do for a break, but before we go on that break, I'd like to ask, is mental health challenge, is it death sentence?
It is not a death sentence, and I wish I could say this in uppercase letters.
Okay.
Yeah.
So at least whoever that has it, they still have hope, right?
Absolutely.
Great. Let's go to a quick break, and when we return, we'll continue this conversation with Esther Abbah, who is a psychotherapist on mental health. I will see you after this time out. Join us again. Suicide is a spirit that once it comes into someone, the person is just overwhelmed, and then you just feel that at that point the person just wants to go through that route because you feel that's the only way out. So how do we talk to such person and remove such person from, if it's a spirit, that's if you think it's a spirit, because I'm sure the person is just being religious. So for you that who is in the medical line, do you see that as a spirit? And if it is a spirit, really, how do we bind and cast that spirit?
Suicide is a sad one, and we often say how it is it's a permanent solution to a temporary problem. The person who's trying to commit suicide has contemplated suicide. So they did go through a phase where, they thought about it. And for the most part, the person who's trying to commit suicide also has a tiny bit of reason why they want to leave. Before they get to that point, they had sent out 1,000 of signals, and we missed it.
If you just joined us, this is The Conversation. We are reaching you from KAFTAN television studio here in the nation's capital, Abuja. All right, we're still having a conversation on mental health, and my guest on the show today is Esther Abbah, who is a psychotherapist. All right, so because we're talking about the last word you said is mental health is not a death sentence. It is curable, and whoever that has it has hope. Now, with all that is happening, let me bring it back home, especially in Nigeria. With all that is happening currently, inflation gone record high, you go to the market trying to buy something in the morning, and then you go back again, the price have changed, and people's income are not able to, they're not commensurate with their expenses. A lot of people have zillions, thousands of reasons to fall into depression. I've talked to a lot of people, and then they tell you that the same 10,000 that I used to buy my fuel to fuel my car, I cannot even use it to fuel the car for at least 1 week. So, and I cannot use the same money I used to buy fuel. My salary I cannot just spend it on only fuel. I have to feed, I have to do other things, I have to take care of family members. So these things make people to fall into depression very quickly and very swiftly. So in this case, we already talking about bringing it back home, because this time they are there already. So I have this, I keep telling people, no matter what, just try as much as possible. At least just take care of your mental health. Just don't die on us. So in this situation, what exactly are the right words you start telling to people, or you start talking to people, especially for that one who is watching us at the moment? Because sometimes you just say mental health has to do with probably someone who has slipped into depression because they've lost their family. But if it is someone who has not lost anybody, they have not lost their job, they still have their job, but their income is not commensurate with their expenses, how do you talk to such persons so they don't slip into depression or become suicidal?
Now, this is where the word hope comes in. If someone hasn't died, if you're not critically ill, and first of all, I want to start by empathizing, because as you're saying it there and trying to fit myself into that shoe, I do not know how people do it. And I want to give it up to, Nigerians, because the resilience that we have, is unmeasured. And, my heart goes out to the people of my beloved country, Nigeria. Now, that being said, if someone hasn't died, if you're not critically ill, we have hope, right? Which means we have to focus on the here and now. What stems, where anxiety stems from is the thought of, okay, I only have 10,000 today. What am I going to do tomorrow? And what am I going to do, the day after? But if you don't take care of today, you mightn't make it to tomorrow. So it's being present and taking each day as it comes, because I don't know whether to say the universe has its way or God has its way of delivering, and it's taking that one step. Just put one foot in front of the other and take it as it comes. There is a circle that I normally use to explain stuff, and on the top part of the circle is everything that you can control. The bottom part is things that you can't control. Where the prices of things go tomorrow morning, we can't control that. What we can control is the interpretation that we give to it. So if price going up means you're dead, your brain is going to pick up that signal. And, in the next couple of hours, what you're saying is everything that is negative around you. Whereas in reality, you do have enough money to feed you in the moment. And I know we can talk about this. This doesn't in any way mean that I'm undermining the struggles of people. And this is where skills and passion can come into to say, I'm not making as much money. What else do I have in my control that can make me, even if it's an extra 200 naira, that kind of way. And, to take it from there to start with.
All right, so let's talk about suicide, because these days we see people just go to the third mainland bridge. They just want to jump down. Some people just want to jump down from one 4-story building, or some people just want to take one thing or the other, just swallow one thing or the other, one drug or the other, and just end it at that point. So what are the kind of words we should be telling people? Because everyone is going through stuff, and when someone comes to meet you and tell you that okay, I need XYZ amount to pay XYZ, and you are not even able to give, and now that person now becomes suicidal, how do you talk to such person? That's one. And secondly, I was talking to someone yesterday, and then she said that suicide is a spirit, that once it comes into someone, the person is just overwhelmed, and then you just feel that at that point the person just wants to go through that route because you feel that's the only way out. So how do we talk to such person and remove such person from, if it's a spirit, that's if you think it's a spirit, because I'm sure the person is just being religious. So for you that who is in the medical line, do you see that as a spirit? And if it is a spirit, really, how do we bind and cast that spirit?
Suicide is a sad one, and we often say how it is it's a permanent solution to a temporary problem. The person who's trying to commit suicide has contemplated suicide. So they did go through a phase where, they thought about it. And for the most part, the person who's trying to commit suicide also has a tiny bit of reason why they want to leave. Before they get to that point, they had sent out 1,000 of signals, and we
Oh,
missed it.
so it means whoever that is
People
beside
don't,
the person missed that signal?
absolutely yes. People don't just wake up first thing in the morning and say, I'm going to commit suicide. They gave out signals. We just missed out on the signals. So first of all, they probably weren't eating. They became really quiet. You'd find some, excuse my language, some shady movements there, right? And we just thought, I'm going to focus on my life. You're focusing on your life. That person is sitting there all by themselves, and trying to figure it out. And it's hard to say, sometimes it's hard to say, I'm going to this. And what we do in suicide first aid is to make that connection, pick up on the signals and make that connection to say, you're not yourself, what's going on. Half the time, if you persist, the person is going to tell you what they're going through. And then find a way to establish a support system and the help that we can give. And in my journey of being a mental health practitioner, there are a few things that, have struck me. And I think that in this journey of mental health, there is the role of the individual, there is the role of the system, right? The role of the individual is what I do to minimize stress and to protect myself and to take care of myself. And it could be as simple as saying, can you sit with me for a moment? I have thoughts in my head that are not quite good. And that's opening the door for you to come. But it's also me sitting to the side and refusing to talk to you as per normal. That's also an invitation for you to step into my life. It could be, I've been starving for the day, and maybe you have a 5 naira spare to give, but sometimes we're all caught up in our own world. The role of the system is, what can the government do to make this less stigmatizing for people, to open up that avenue where people can go explore, or maybe that the cost of healthcare isn't as much, or maybe there are people in the society or the system that could offer, directions to where can you go and get the appropriate help. And we have to look at all that. I don't do religion in psychotherapy. I'm a person of faith, but like I said, it can be a spirit. It's probably not. They have gone through it, and at this point, maybe out of shame, or they've hit rock bottom, and they find that the way back up could be extremely stressful, and they just want to be done.
All right. So, thank you so much for that particular part. I'm sure whoever is listening, they're able to learn. So for me, if I have to talk to someone who I think is suicidal, what is that first word that should come out of my mouth? Because a lot of people will just tell you, don't worry, it will be fine. I know what you're going through. I feel your pain. But sometimes you don't feel their pain. You just want to say some words. So I'm sure that there are some words you're not supposed to tell people at that point. Someone who has just lost their family, probably in an accident, or a husband, a newly wedded couple, a husband who has just lost his wife and the child, and you go to tell the person, I feel your pain, God will help you, God will return, God that takes is the one that brings, and all. What are the right words the first right word that should be like the first aid you should tell people who you think are suicidal?
Sometimes the right words to say to someone who is in the depth of emotion and psychological stress is to be quiet. And I know that sounds kind of awkward, because no, you don't feel their pain. No, you don't know what they're going through. And also, sometimes when you find someone who's going through a traumatic event, do not begin to tell them your story or some other story that has happened before or whatever, because I suppose that person by themselves probably has a relationship with a God or something. Don't narrate what you think could have been a worse experience, because what you're trying to say is your pain isn't valid enough. And I think that's an absolutely rude and an invalid thing to say, or to say, don't cry. So All of those emotions are normal. We go through regret, we go through anger, we go through all sort of stuff, and at some point it works out that you come to a point where you agree with the event that has happened and you begin to seek help. So it could be just being there, take your kids away for a couple of hours so that, they're not trying to juggle 10 things at a time, to
Okay.
give them time to process things. It could be, say, I bring you food and I just want to make sure that you've had something to eat and had a shower. So too many stories can be quite invalidating, and it can also feel like a dump. What happens is you make it about you rather than about them. So please do give people the space that it takes to grieve and to understand and make sense of what they're going through.
Absolutely. Okay, so now let's talk about, dive a little bit and talk about some of the things that interest you particularly. We understand that you're mainly intrigued by how mental health affects people of different races, especially in the African, Asian, and European communities, as well as how you manifest, how it is interpreted, and also dealt with among these cultures. Help us understand why does that intrigue you? That's first on the side. And then secondly, talking about how mental health affects the European person, the African, the Asian. Really, that's a whole lot. Tell us about this.
So why I'm intrigued about how mental health affects the different cultures that I've experienced. So I've lived in Hong Kong, I've lived in Singapore, and now I live in the Republic of Ireland. So I'm Nigerian, so African, Asian, and European cultures are things that I've experienced over the years. Say in Europe, mental health is something that, it's being promoted, it's being talked about. Some organizations are coming up with a mental health leave, for instance, to say, I'm not doing well today. I'm not diagnosed with depression or anxiety disorder or any of those stuff, but today I don't feel mentally capable to take any job. And they could say, take the day off. It's not something that we experience in Nigeria. A woman's child could be sick at home and all the boss cares about, is that they show up to work, where we come from. And people don't have that understanding that the mind can be unwell as the physical body can be unwell. And as we all know, what happens in the mind, what happens, physically, by the time you start feeling a headache, your body has processed it. So it starts internally. And this is all of that stuff. Now, majorly with mental health, there is an external trigger. It intrigues me because back home, we don't talk about it. And once you talk about mental health, then everybody just withdraws and like, oh, you're psycho, you're mad, you're all of this. Whereas maybe it's at the beginning stages of the challenges. So when I put this together, I'm asking myself, what's different? How you were saying there that someone mentioned that suicide is a spirit, right? Well, it could be considered a spirit because it's a thought in your mind, and I know where it comes from. Some people say they don't know where it comes from. It comes as a result of unresolved stress, unresolved trauma, unresolved anxiety, and all of those stuff. Now, back home, I've seen people who, eventually took to the street and they're stripped naked because they have lost their sense of self and their capacity, to maintain, that level of, self and, cognition. And I'm curious as to how do we let it get to that point? So this is what intrigues me, the openness, the lack of openness, the community and the society's acceptance of it. In the medical system, there would be a ward that is, reserved for, people who are struggling with their mental health. There's systems in place that we don't just shove you to a talk therapist and after that you're gone, but that you can go to a psychologist for an evaluation, probably go to a psychiatrist for an evaluation, because who knows, there could be something happening internally that, an imbalance of hormones or whatever is triggering that. As a talk therapist, I mightn't be able to tell you that until I refer you on to, back to the GP, to the psychologist, to the psychiatrist, and, all of that. And I feel that sometimes in some societies, that that sequence of things isn't available because it's undermined.
Oh, great. So now with what you're saying, it means that the way they perceive mental health in Africa is that, or in Nigeria, is different from how they perceive or how they accept it or how they deal with it in the European or the Asian country?
Absolutely, yes. So someone comes up with maybe gives you an invitation, like I said there, that you're struggling with the mental health, and what we could possibly do back home would be to begin to cast and bind them. If you have hormonal imbalance, if you're dealing with grief, casting and binding you is an inappropriate thing to do. Here they would say, can you speak to a therapist? Can you speak to a counselor? Can you go see your GP to see, what they have to say to it? So it's different approaches. The one thing I must say though is that, in Nigeria, I do experience that, the African culture is more family oriented. We have a bigger sense of, community, even though in these days I feel like we're westernizing a bit more. And the society in the sense of community does help, to help with our mental health as well, because human beings are not created to be in isolation. And we do have a high sense of resilience as well.
All right, so even as we begin to round up, I also understand that you are interested in psychotherapy and psychoeducation, which is centered around mental health and empowering individuals and groups towards mental and emotional freedom. So talk to us on that. How do you actually help people to gain, whether individual or group, how do you help them to gain their mental and emotional freedom?
Well, it starts by talking about it, and making sure that over a period of time, that would be the goal. The World Health Organization has already declared, I wouldn't quote an exact date now, but it's not far from now, that mental health, according to World Health Organization, would be the next pandemic. And God absolutely forbid, but I can guarantee you that it would kill more people than COVID did. Right?
Wow.
And this is why we should talk about it. That it's general, it's not just restricted to Europeans or Asians, but that it's Africans, can suffer from mental health as well. And it's just saying, the body gets sick, we're all created in the same image, once you put the outer color aside. And that means that we have to be more welcoming to, the possibility of falling into mental health challenges, and begin to actively work towards what we can do as individuals, but also as systems, to delay that, or even to absolutely prevent it from happening. So it's talking about it. It's linking people up with the available support systems, what they can do for themselves, what they can do as a society, gaining a sense of self and their own purpose in life, and the things that they can do within their control to bring their purpose, and their goals to fruition, So it's pointing people basically to the resources that are available. Again, the role of the system and the society is to be less engrossed in ourselves, to say, you're a little bit different today, what's going on? And I also indulge people, as many as would see this, to reach out for help. We're not meant to be in isolation. And sometimes by talking to people, it's half of that burden reduced. You haven't solved it, but you are now not carrying it alone. I had a quote that struck me, and it says, you are 4 significant people away from someone who can help you.
Oh, wow.
Yeah, 4. That's not a lot, So if I'm not able to help you, I might know someone who might know someone who can help you. So it's really saying, don't suffer alone, Don't keep quiet, because what if the person sitting beside you is able to, point you to the help, or even be able to help you? So speak up is one. And for anyone who's receiving that invitation I talked about, please be open to the idea of giving the help that you can. It could be 5 naira, it could be 200 naira, and we can lean on each other, So.
All right, so I recall also when I was talking to someone yesterday, and then she said that she has a daughter, and then the daughter was complaining that at some point she felt depressed, and the daughter is just about 16 years old, and then she told her daughter right in front of me that you're too young, in fact, you're too small to be depressed or have anything to do with mental health issue. So, two questions before we round up the show. One is, does mental health challenge or depression, does it have age brackets? Are there a specific age that it's only, you're not supposed to fall into such at XYZ age? That's one on the side. And then secondly, we'd like to get your last word to that man or that woman, or maybe that adolescent or adult who, or even a group of people who are watching us at the moment, and then they just need that one word that they can hang on to and say, okay, I think it's not good yet, but it's all going to be fine, and I'm not going to commit suicide again, and I'm going to take care of my mental health as from this day forward.
First of all, mental health doesn't have an age bracket. A 4-year-old can have symptoms of depression as well. And what we need to look into is what's happening in the immediate environment, what's happening for them in school. At 16, depending, some people have just reached puberty or becoming young adults, and they're trying to figure out who they are. That's a very confusing state. This child goes to school and sees all their age mates and what's going on for, you know, each one of them, and there could be a basis for comparison and stuff like that. So
Okay.
it would be unfair to just shut her up like that, but to, you know, be a little bit interested. Now, this is the other thing. Someone has said, I feel depressed, and like, you're too young. Now you shut them up, and that could be a trigger that can spiral them into further negative thoughts because, you know, I'm unheard, you know. So if I'm not heard, I have to look for a solution that works for me, and the solution mightn't be the most effective or the, you know, the best option out. So please, let's try to hear each other out. So yeah, mental health has no age bracket, and that's quite a sensitive stage or age in life. There is a lot going on for teenagers at the moment, and you know, you can only feel very sorry for them because they are up against a lot of vices.
A lot of, yes,
Yeah.
definitely.
All
right.
Yeah, my final words are, please don't suffer alone. I'm quite interested in the systems that are available and working in Nigeria at the moment. I won't be able to tell you, you know, I know one therapist in Nigeria, and even as we're talking now, I'd be interested to Google it up and find. I think it is the role of the systems, you know, like churches and mosques and, you know, workplaces to, you know, search out those support systems and create an avenue where people can explore and rely on each other and communicate some of these, you know, mental health needs, so that we can begin to find solution as individuals, but as a system. My last words are, please don't suffer alone. I know I live all the way here. I would be interested in collaborating with you in the future, Annabelle and KAFTAN TV, to see what resources are out there for people that after a program like this, you have details of, you know, support systems that people can reach out to.
Most definitely. Well, we would be waiting to collaborate, make that collaboration happen very quick, soon. Thank you so much, Esther Abbah, psychotherapist. It's been it's always a pleasure having this discussion with you on mental health.
You're very welcome. See you again soon.
Great. All right, viewers, that's all we can take for today. I'm sure you must have been rightly educated, entertained, and informed to ensure that you take care of your mental health, and whatever it is, please say something. And if people are around, people who are around someone who you feel is acting a way that you do not understand, or acting a way that he or she has never been used to, please take care of them. See how we can take people out of being suicidal, because this mental health issue, it has been a serious problem, and we need to keep talking about it. I will see you next time. My name is Annabelle Oji. God bless you and yours, and God bless Nigeria. Good evening.